My current research interest is in cancer survivorship and supportive care. I think my main motivation for research comes from my father having cancer. My father do share with me some of his experience as being a cancer patient and survivor. So I mean, yeah, you have all this treatment that is life-saving that can treat the cancer, but after the treatment itself, or even during the treatment, they do experience like side effects. He had to deal with the pain from the tumor itself. So like the cancer actually spread to his bones, if I'm not mistaken. And then like that comes with very generalized pain that he keeps experiencing every single day. So no matter what pharmaceutical drugs, that we gave him, like opioids, that's the strongest one in the system right now. He wasn't able to feel any better. I think I won't ever forget like his face and his whole like he's suffering through the cancer, and I was thinking, if let's say other cancer survivors are also experiencing the same issue, I mean there's definitely more I can do as a researcher. My research funded by PhRMA Foundation actually involves looking at how acupuncture can help with cancer-related pain. Acupuncture right now is in a very interesting space in the field, whereby there's a lot of evidence for it, but at the same time, you can't exactly increase the use that quickly because of various barriers. And one of the barriers I'm trying to tackle is the unstandardized coverage of acupuncture for cancer-related pain across different health plans. And the reason why is because there's not a lot of economic-related data to actually tell like the plans that, hey, it is good to put acupuncture in their plans. So one part of my research actually looks into that, specifically, whether the healthcare utilization, the use of different, emergency room visits, etc., cost to the insurance providers is actually reduced when, let's say, acupuncture is being taken on for cancer-related pain. The second part is to deal with the hesitancy from providers, because not everyone is convinced about acupuncture. I was actually trying to see what type of other evidence that could potentially convince clinicians, because I am a pharmacist, so I do know like what are some of the considerations that a clinician may have. So one of it is whether we can actually sustain the use of anti-cancer treatment. But there are some anti-cancer treatment that causes pain, and as a result, the patient stop using it. So as such, right, I was thinking, let's merge the two together. Can I actually use acupuncture to actually make sure that the pain-inducing but life-saving anti-cancer treatment is actually being maintained based on the recommendation? Actually, I think I'm actually experiencing some of the impact right now, because I think it is firstly a very prestigious scholarship, so that actually make it perhaps easier for me to find an internship right now, or maybe like other research projects that I could potentially work on, because they know that PhRMA Foundation do look at like proposals very carefully. So the fact that I got funded by that actually looks really good on my CV, and that makes it easier for me to get more opportunities in the future and the present as well. I guess I hope to be like a bridge connecting between different stakeholders. I'm still trying to figure out what's the best way I can be for that bridge. Essentially, that bridge and the stakeholders include like patients, caregivers, like clinicians, even pharma industries, and even non-profit organizations as well. And I would like very much like them to all come together and come up with different ways to actually help with cancer